Hi, I'm Mayor Wayne Smith, and welcome to Irvington's Health and Wellness Day. And we have a tremendous amount of subject ground to cover, from basic tips about how to preserve your own health to the systematic processes that impact how we get health care, how we procure it, what's the status of healthcare workers, what is the Affordable Care Act all about. So we'll have a range of speakers, even regarding issues like emergency management and health insurance in a broad sense, from one of our distinguished insurance brokers here in the state of New Jersey. Again, I'm Mayor Wayne Smith from the Township of Irvington, and in my dual capacity as president of both the New Jersey urban mayors, which are the largest cities in New Jersey, my colleagues throughout the state, urban, rural, and suburban, have elected me president of the New Jersey Conference of Mayors. So let's get to it. Our first presenter will be Celia Traeger, who's with the Alice Wellness Center in Millburn, New Jersey, and she'll be talking to us about, and her title is Certified Colon Hydrotherapist. And so many of you who are concerned about colon cancer and how we preserve our colon, I'm sure she'll give us some tips on how we do that. Celia?
Hi, this is Celia Traeger. I'm from Alice Wellness Center. In our wellness center, we're trying to reach out to the community, teach them in their health and their well-being, and mainly the young parents, mainly the young parents and the elderly people. And I work for the community, and when I see daily basis the people that come in for different services, mainly our services is detox. We basically focus on colon and well-being and eating healthy habits. At the center, when the people come in and the questionnaire they fill out, based on the questionnaire, you're able to actually detect what they're doing wrong, what is wrong with their health, and the 90% of the time the people come in, you see that they have issues with the constipation, issues that with diabetics, high blood pressure, and cholesterol, mainly that areas that are my focus with my clients. And mainly most of it is eating habits. The people have a poor eating habits, some people have an eating healthy habits, and my goal is try to educate them as much as I can. And I participate in different programs in my center. It is actually says that on my website that doesn't make any difference where you're from, the age or size that you are able to call in and set an appointment. My consultation is complimentary to all whoever calls and comes to the center. Of course, the services we charge for, but when it comes to consultation and their eating, try to educate them on the well-being and all, and they can call anytime, they can come in. And what I realized that the people today, they will eat what is there, and they're trying to look for a quick eating habits, but it is there. You can eat healthy as well. Just basically mainly focus on your water and fiber. And from the 70% of the time and I realized that when people come into center, they don't drink enough water. They don't eat enough vegetables and fruits.
So how much water, because there's all kinds of theories about how much water one should drink. How much water should one drink?
Sure, it is a really very simple answer for that. We know that our 60-65% of the body weight should be water. And for them to realize that how much water they should drink per day, they can divide their body weight by 2. The number they can get, that will be actually amount the ounces of water they can drink per day. The example, if you weigh 100 pounds, that you should drink at least 50 to 60 ounces of water per day, because you lose that amount of water every day, and you gotta put it back too. And the second most important thing is fiber. People that come to us mainly is the lack of fiber, not all the people.
So now what foods are best for fiber?
The best foods for fiber, vegetables and fruit. Okay? If you're not eating enough vegetables and fruit, chance that your body's acid level will be higher, your pH balance will be much lower. It is for the fiber intake, mainly that focus on your vegetables and fruit. We know the special fruit known as cleaners, vegetables known as healers, and the human should consume between 25 to 35 grams fiber per day. Mainly that should be your vegetables and fruits, nuts and grain. As long as you go with fiber and water, believe me, your weight will go down, and as well your health most definitely will get improved. The majority of the people coming up court, they're trying to improve their eating, and also I will say that 70% of the people, they're trying to come in to lose weight, and my approach will say that, okay, I know you're trying to lose weight, how's about let me teach you to eat better, will help you to lose your weight, rather than focusing on the symptoms that's what you have. Try to improve what you have, to maintain your body, and try to improve the pH balance, try to drink your water, regardless you like it or not, is a contributor to your health as well as your well-being and the weight loss.
So if I come to the center, do you take my health insurance?
Mostly health insurance companies will not cover that procedure. However, some people do have flexible spending accounts that we take flexible spending account. I work and I serve the community that some people does not have a health insurance. Some people fortunately have them. The people does not have a health insurance, and I will go out of my way just to help them as much as I can. And my goal it is have about at least 15 people that a month that I able to volunteer for myself. But the people that come in, they have to be qualified. For this, have obviously very low income people that can be in Medicaid, or the large family that they don't have insurance, and I will just simply volunteer myself for them. They can come in once or twice a month, and if they participate in the program, and I teach them the eating habits, but it's simple that if you don't participate, then I'm not going to volunteer myself for you. If I'm volunteering
so
myself...
So you have to follow the regimen?
Then you have to follow the regimen as much you can. I don't expect 100%. If you can participate, at least 50%. I mean, I expect at least 5 to 10% changes a month, and again, every person, if changes 5% a month, and 60% changes a year, 10%, 120% changes a year, and everybody can improve their health.
Well, see, I want to thank you. Certainly, we got some preventive measures in terms of dealing with some of the impacts in, communities like ours. There's prevalence of high blood pressure and those kinds of things, and there's always this great discussion about how much water. So you gave me some more perspective in terms of how much water we should be drinking, because water is just one of the keys to life. So thank you very much.
You're very welcome. And mainly the last tip for people, if you have a high blood pressure, cholesterol, diabetics, remember that all of them, it is a lifestyle diseases that you created on your own. You can improve it just with the way of life.
And if people wanted to call you to ask about your service, how do they reach you?
The people actually can contact us through our website, www.aliswellnesscenter.com, or they can reach us through our phone, area code 973-912-4448. They can contact us through our Facebook pages, Alice Wellness Center LLC. Also, they can email us. Pretty much we can be available to them almost like in 15 to 16 hours a day.
Thank you very much.
You're very welcome.
So our next presenter represents probably one of the more progressive organizations in our state, serving both as a citizen watchdog and a consumer watchdog. I happen to know about many of their great works, having served on their board for a number of years. And one of the initiatives that they are working on is really creating ambassadors around the Affordable Care Act. And so, to those who are not familiar with the Affordable Care Act, the misnomer is Obamacare. It is the Obama cares, but it's not Obamacare. Obama does care.
That's okay. If people know it as Obamacare, that's exactly right.
Right, but it's the Affordable Care Act.
That's right.
And Dina Matola Jaborska will be talking to us. She's the Director of Organizing and Strategic Program Development at New Jersey Citizen Action. Dina, tell us a little bit about the Affordable Care Act.
I would love to. I think that folks may know that for many decades there was an effort in this country to pass comprehensive health care reform. And in 2009, the Affordable Care Act, Congress did pass it, and it is comprehensive health care reform. It attempts to move all of our uninsured in our nation into coverage. And some aspects of the law went into effect last year and the year before, but this year is a really key year for implementing the law because this is the year that the new coverage options become available under the Affordable Care Act. And the whole goal of the law is to make health insurance and coverage affordable for people of all different income categories. And so what I was going to do is just give a little bit of information about what's becoming available. And when. Yeah. Yes, and how you get it, how you access it. Mm-hmm. So on October 1st, there's going to be two different types of coverage options that folks in New Jersey and around the country can access. The first is Medicaid is going to be expanded for people, including adults with no kids, up to 133% of the federal poverty level. That's for a family of four, about $33,300. So that represents an expansion, mostly for the childless adults who couldn't access Medicaid in the past. So that's one new option. And the second will be, there will be something that is being called the Healthcare Marketplace, which is basically a website that will help people. It's very consumer friendly, it will be. It's being posted by our federal government, the Health and Human Services Agency, and it can be accessed at healthcare.gov on the internet. And what it is any consumer in our state or in our nation can access it to find out a range of health insurance options that are available, what they're going to cost, what their benefits are that they offer, any cost sharing, and then importantly as well, on the healthcare.gov website, you'll be able to find information about subsidies that will make that insurance that you can purchase on that website affordable. So you can both on the website find insurance options that are affordable and subsidies that people can access under the Affordable Care Act or Obamacare. And these subsidies that are going to be available are available for people up to 400% of the federal poverty level. So just to be simple, the Affordable Care Act will offer pretty good subsidies for families trying to buy insurance on the marketplace if you earn as much as $92,000 as a family. That's 400% of the federal poverty level. So it's definitely the case that it's worth, most people in New Jersey, it's worth taking a look at that website on October 1st when it goes live to find out whether or not, if you don't have insurance, there's an affordable option on there for you and a subsidy that will help make it even more affordable. So that's the key thing, and I think just obvious to a lot of people, but it's worth saying is that, you know, health insurance is a wonderful thing to have for a lot of reasons, but, you know, for one thing, it's really helps give people peace of mind because they don't have to worry about either, you know, coming into a lot of bills or going into debt, medical debt, and also when you have health insurance, it's a lot easier to keep yourself healthy. So our organization is working to spread the word around the state that the Affordable Care Act's new coverage options are going to be available October 1st, and to really encourage people to take a look at it, at the options and what's on there. There's going to be some misinformation out there because there was always opposition to the Affordable Care Act from the conservative organizations in our nation, and so there may be some information out there people are hearing or may hear that the coverage options are not going to be affordable or are not affordable, and that is not going to be the case, and we really encourage people to get the facts.
And this no way impedes Medicare or Medicaid. Those programs already exist and will continue to exist.
Yes, it's both expands Medicaid, so it just lets more people into it and makes the private insurance market more affordable for people.
Now, what about the small business sector of the economy? There's been a lot of discussion about, is it 50 employees or more that a business has to provide coverage?
Yes, that's true under the Affordable Care Act, 50 or more, and there's also subsidies for businesses that have 25 and less employees. There's a subsidy for them if their employees make less than $50,000, which is most small businesses. Okay. The company can get, and if they contribute half of their employees' coverage, if they pay half of the premiums, the companies can get a 35% tax credit, 35% of the cost.
And if there's and we're going to hear from an insurance broker who will talk about this stuff later, but if there's no existing company that was willing to pick them up, that's where these health exchanges come in? They'll be able to buy from these health exchanges if
Yes.
there's no affordable option?
I mean, small businesses can always go to a broker to get help with the private insurance market. What the exchange or the marketplace will offer under Obamacare is you can access not only information about private insurance and what it's going to cost, but also the subsidy. So when you go to the website, you plug your information in, it'll tell you as a business how much subsidy you would be eligible for, and that is, and also if you're an individual, same thing. So the benefit of going
And
to
subsidy means
healthcare.gov,
a portion of whatever the cost is.
You'll
Who
get
picks
that.
that up? The federal government? Government picks
under
that
tax
cost up.
credit, you'll get it back. So the healthcare.gov, to look, the Affordable Care Act is worth looking at because that's the only place you're going to access the subsidies. Or if you go to an organization, which there will be organizations in New Jersey called navigators, and they will be able to assist you with, the website, the marketplace, and they will be able to help you find out about what the options are, what the subsidies are for you.
Now, will Citizen Action be serving as one of those navigators?
We don't know yet.
Yeah,
We hope
okay.
so. There's organizations around the state have applied for funding from the federal government to serve that role, and we'll find out in August.
Okay.
But either way, our organization will be, whether we get, whether we're full-time, storefront helping people can call us for assistance, or we can point them in the right direction. Should I give a phone number? or
Yes,
something?
yes,
Is that
yes, yep,
helpful?
yep, yep.
Okay.
Mhm.
So the number to call if you need help with finding out more about the Affordable Care Act is 732-246-4772, and that's the number at the New Jersey Citizen Action Office.
And are you available to come out to speak to religious groups, civic groups, block associations to talk about
Yes.
this? Okay.
Yes, Mayor Smith mentioned earlier that we have a program called the Ambassador Program, and really what we've done is trained a bunch of people of all different people who work at organizations, ministers, community leaders. We've trained them to be ambassadors, and what they can do, and our staff as well, is go out and give presentations to the community about the Affordable Care Act, what's available, how to access it. So if folks need a presentation for a group of people, they can call our office and we can either send a staff or a volunteer.
And I'm sure Herb, Glenn, and I will have you come back where we
Yeah.
dedicate a whole show to
Yeah.
the Affordable Care.
Yeah, there's
maybe
a lot.
in half an hour. There's a lot to cover.
That'd be good, yeah.
Okay. Dina, thank you very
Thank you
much.
so much. Thanks for
Have
having
Have a
us.
great day. Enjoy your weekend. If you will come over, and we'll start with you. Now, one of the issues that primarily affects the African American community, and we have a person who is directly involved with sickle cell anemia. We early in the year did a walk dedicated to sickle cell awareness in Irvington Park. And so today to talk about sickle cell, the status of all the research around sickle cell and her own journey, if you will, is Tessa Allen. And Tessa, welcome, and tell us a little bit about your story.
Thank you for having me, Mayor Smith. So my name is Tessa Allen, and I am a sickle cell patient. As you know or don't know, you're born with sickle cell. Both parents have to have one of the genes, and they pass it on to 1 in 4 of their offspring. So luckily, unfortunately, I'm the first for my parents, and I've gotten the sickle cell gene. So before I wasn't diagnosed until 1988. So I've grown up with sickle cell, not knowing that I had sickle cell disease. I was diagnosed when I was 2 as having polio. But I was actually in a sickle cell crisis. Now, sickle cell crisis is extreme pain. There's nothing but pain medication to manage the pain. So growing up all those years until 1988, I was going through all this pain, getting all these different diagnoses, and nothing helped. Anyway, with the sickle cell, I have to watch my diet. As Ms. Traeger was saying, you have to be very diligent with your diet. You also have to...
Now tell me some things. Now, is there, and you may or may not notice I may be reaching a little bit too deep in, but is there any way, once diagnosed, to prevent sickle cell from occurring?
No.
Okay.
There's no cure
Okay.
for sickle cell. So the only thing is pain management
Okay.
when you're in a crisis.
Now,
And
what kind of things should you be eating if you are involved in sickle cell?
very important is for you to always stay hydrated.
Okay,
And
so
that's
water
a
is
very
critical as-
yes,
as
yes,
still-
especially in the summertime.
Okay.
So
And
it's
I think
very.
that's your water over there.
That is my water over there. I keep water. My bed there's water in my bedroom at all times. So it's very important for me to stay hydrated. It's very important for me not to get too stressed out, because that can trigger a crisis. It's also important for me to be very careful in the summertime, and also when the seasons change. When the seasons change, you'll find a lot of sickle cell patients in the emergency room. And because the doctors are aware of how quickly your pain levels can go up, so within minutes you can go from a 2, pain level 2, to anywhere you can escalate to as high as about 9 or 10. So it's very important that when you get into an emergency room in a crisis, to let them know you are a sickle cell patient, so that they can see you first and start the pain administration as quickly as possible, in order not to get into anything more serious or death. So, but I've been very blessed. I have 3 kids. And I must say that even with sickle cell, I have the milder version of sickle cell disease. I have the SC. The SS is the more severe.
Any of the children impacted at all?
No, because
Thank God for that.
thank God, my husband is not. My husband doesn't have the gene.
Okay.
So all my kids have the trait, the sickle cell trait. Now what they have to be careful about is when they marry, they have to be careful that their partner does not also carry the gene, because then their offspring is 1 in 4 of their children could get exactly, so it carries on. But I don't have the severe form of it, so I'm able to go through life.
They call it manageable.
Exactly. The pain is the same.
Okay.
The pain is the same. I can be fine today, and tomorrow I may not be. I could be in the emergency room. So I'm very diligent with my care. I'm very diligent about not getting overexerted, not getting fatigued. I'm very careful about hydrating myself. So, and also my diet. You know, I have to watch what I eat. I can't eat anything that I want to. So I'm very, very diligent about those things.
Great. So what would you say to people who want to contribute to combating and the research? Is there organizations that do research around sickle cell, and what are they? And are you involved with any of those organizations?
I'm actually not involved in any organizations, but what I can say to people, it is very important to donate blood. Because if your crisis is that bad that you need a blood transfusion, blood has to be on hand. So it's very important that people are aware that they should donate. And if you are, I think it's the O level, that's the best blood to donate. So if you are an O positive, I think it is, then please go out and donate, because
So
that's the way.
Blood that's kind of more neutral
For everyone,
right?
correct, thank you. When I was diagnosed, I ended up having to have a blood transfusion. That was my first blood transfusion, and that was in 1988. Now, the HIV virus was becoming very prominent.
And they were saying it was spread by blood transfusion.
Correct.
So you were reluctant to do it.
I was very reluctant, and I was at death's door. And every day, teams of doctors would come in to urge me
To go ahead and get the blood
blood transfusion. So I was very fortunate. I did decide to do it. I came through everything. I was tested later, about 3-5 years later, for the HIV virus. Thank God, it was negative. But I do urge people to donate blood. And if you're in my position, I'm urging people also to accept that blood transfusion because it's a difference between life and death.
Now, is sickle cell a normal test that they give when you're a child now so that people know if you have the trait or not?
Yes.
That it is?
Yes. That's part of the marriage certificate now,
Okay.
that if you're...
Oh, so even when you get married, you get...
Yes, you have to get tested. Both people have to be tested for that trait. And newborns are tested as well. Correct.
Well, I want to thank you, Tessa. I know that you were nervous when we started, but I told you we would just be having a friendly conversation, and I think you did well. What do you think?
Thank you. There's more that I can talk about, but I
We're going to
think...
bring you back at another time.
Thank you. Thank you for having me, and thank you for putting up with me.
Have a great day.
Thank you so much.
So we're going to change gears just a second. I'm going to ask my other panelists, Chief Shumlick of our own fire department and Craig Lordigan, to come up front so that we... You sit right here. So Jean Pierce is with us, and she's the public policy person for the health professionals and allied employees. It's a AFL-CIO union. And let's start out, Jean, by telling us what kind of health professionals do you represent? And allied employees.
Yes, thank you, Mayor Smith. And first, I have to wish you a happy birthday.
Oh, thank you so much.
Very nice of you to be here on your day. And I want to thank Herb Glenn and the We Care Partners for having me back again this year and for hosting this fine event. As the mayor said, I'm with the Health Professionals Allied Employees. We're the largest healthcare union in New Jersey. We represent 12,000 healthcare workers, RNs, and professionals. And professionals range everywhere from your social worker and researcher to the IT people in a hospital, again, social workers, professionals, X-ray technicians. So it's a wide range. We have 12,000 members across the state of New Jersey.
And I'm sure you're impacted by a number of things that are going on in the healthcare industry. So I'm going to lay out a couple of them and then you respond to them. So one is the potential, I guess, I don't know if it's a shift in what's happening at University Hospital.
Yes.
I know you're looking at the potential acquisition of a number of medical institutions like St. Michael's and others.
Yes.
You know, we just saw where St. Barnabas acquired Jersey City Medical Center. So how does that affect your membership? What's your thoughts on these kinds of acquisitions, and just share your perspective?
Thank you. And there are, as you say, many, many different things happening in healthcare today. When I was here last year, we did discuss University Hospital in Newark was being separated from the University of Medicine and Dentistry because that was going to become part, and it's happening, part of Rutgers University. And in South Jersey, some of it goes to Rowan University. But University Hospital in Newark, there were bids put out for a management partnership, and two healthcare companies have put a bid on. St. Barnabas, as you mentioned, just bought Jersey City Medical Center. They have a bid in to be a business partner with University Hospital, as does Meridian Healthcare, which their business is primarily in South Jersey. So we're waiting. Those bids, I believe, have come back and they're in the review process now. I was just recently appointed to the Community Oversight Board, which the legislation that did the reorganization of higher education in UMDNJ provides for a oversight committee to watch University Hospital to ensure that services remain, people still have access, it's still good quality health care that you get while still sustaining the hospital.
So just tell me a little bit about the board. How many people are on it? What's the makeup of it?
I'm going to say, no, you put me on the spot. I believe there are 6 to 10 people on, someone from the community, immediately from the Newark area. President Barchi from Rutgers is going to be on it. The CEO of University Hospital will be on it. The Senate President gets a nomination. The Speaker of the House appoints someone. So it's a mix of people who, again, are going to be looking at the bid process, watching what happens, and then seeing it through for the next few years.
Okay, well, great. And so tell me a little bit more about some of these other maneuvers going around St. Michael's. There seems, how does the health exchange is going to affect your employees? And tell me your take on the Affordable Care Act and how it affects your membership as well.
So if I might, I'm first going to start with the transitions, things that are happening with hospitals in New Jersey today. New Jersey has had, almost all of its hospitals have been not-for-profit hospitals. Over the past 10 years or so, we have seen 6 or 7 hospitals close.
Well, Irvington General
was one of them. And we're also seeing now where there is a trend toward making not-for-profits into for-profit hospitals. And hospitals systems are hurting today. Healthcare is a very expensive proposition. It's very difficult for hospitals to survive. Medicare, Medicaid, private insurance, some people have no insurance. And so we find that hospitals, a lot of them are distressed. Our concern is because a hospital is distressed, we don't believe the only option should be close or become a for-profit. Not that for-profits are a bad thing. There are some players out there that are very good, but we see that from across the country, companies are coming in and trying to make not-for-profits into for-profit entities. And when you are a for-profit, you have investors that need to see a return on their money. And our concern is what happens then is services shift. They reduce the amount of services. They are more selective as to the patients that they take into their hospitals. There's no transparency. All of these hospitals still get Medicare or Medicaid money, charity care money. Our position is if you receive federal or state money for support for your patient care, then you need to be transparent about what happens to that money. So we have at HPAE, Health Professionals, several things going on. We have a bill that Senator Weinberg is trying to move now again in the Senate that for-profit hospitals have to be as transparent as not-for-profit hospitals. It did go through both houses, and then the governor didn't sign it, so we're trying it again. Because again, we believe that's key to patient care, is where is the money going, and is it in fact being invested in patient care? Non-for-profit companies or entities put any profitable money back into the services, right? They don't put it into their pocket, and that's a big difference.
It reminds me of the old Blue Cross and Blue Shield when they tried to privatize.
Yes.
The requirement that because it was a nonprofit, that the profits had to be plowed back in.
Right,
and so it stopped that merger.
Yes.
Right. It actually stopped that merger.
Yes, yes.
Or sale, rather.
Right, and so we're, again, it's, we want our hospitals to stay open. We're not opposed to for profit if it's done in the right way. So there are a couple of laws in New Jersey that hospitals have to go through a process. One is called CHAPA, which is the Community Health Assets Protection Act, and the other is a CN, or a Certificate of Need. So hospitals have to prove that there is a need for there to be a transition of ownership, and there has to be a fluid process of transparency with regard to the finances, who the buyer is going to be, what their intention is. Again, we want to ensure that neighborhoods, that the hospitals can stay open. We don't want to close anymore. As you know, Irvington, again, lost their hospital. Now you have to go outside Irvington.
And it burdens those other hospitals, the emergency rooms, et cetera, et cetera. So, it's a challenge.
Yes.
You go to some of these other places nearby,
right.
It's presented a unique challenge.
So for the patient, for the consumer, it's difficult to get to a hospital in an emergent situation. And yes, the healthcare workers are finding it more challenging because they're dealing with a lot more population.
Volume, absolutely.
Right. We do see that the ACA, the Affordable Care Act, however, is going to be a good thing for healthcare because so many people that come to the hospital today don't have any kind of healthcare. Right, their employers don't provide it, they're minimum wage workers, they just don't have access.
They lost their job, they lost their benefits.
Right, benefits is a big thing. There are families on charity care, but not everyone. So again, you could be someone who is working full-time for an employer that's paying you minimum wage, and you still don't have enough resources to get the care that you need. So we see that the Affordable Care Act is going to take care of that for a lot of people. New Jersey hospitals, when you show up in an emergency room, the hospital is required to care for you, but that does not always mean they get reimbursed for that care. And so we see that as a win-win for the healthcare system.
So, Gene, I have to ask you this as we close this segment. And it's all the stuff that I've been reading, and I'm sure young people who are looking at career alternatives. Is the healthcare industry expanding, or would you still encourage young people to look at it in its allied relationships in terms of employment to still go into it?
Sure, absolutely. In fact, I would say that the Affordable Care Act is going to bring better opportunity or more opportunity for people to go into healthcare, whether it be as a nurse. You know, they have now Dr. Brennan down in South Jersey has been working with home health, bringing the nurses and the social workers into the home so that people don't have to go outside the home. There are going to be these exchanges. Doctors are starting to get together and build their own.
Hospitals are actually going into it too.
Hospitals also, yeah.
Yeah.
So, it's a budding industry for sure, yes.
Okay. Well, thank you, Jean. Always a pleasure
Thank
talking
you so
with
much, sir.
Good. So we're going to change gears just slightly with our fire chief, Gary Shumlick, before we go to our esteemed broker from the Lonigan Agency. Chief, we're going to switch gears. I won't hit you with the Affordable Care Act, but I want to talk to you about a few things. Fire safety. If we talk about keeping people healthy, we got to make sure they know what kind of fire prevention tips can you give us, so when people are in their home, what you think could they be doing to make their house more fireproof?
Well, the main thing is smoke detectors and carbon monoxide detectors. They're going to help us no matter what. Keeping a fire extinguisher in the kitchen is always beneficial, and knowing how to use that is critical. One of the main things is call the fire department before you start to fight the fire or anything like that. We really don't encourage people to fight the fire. We'd rather have you call us. 911 is the way that we do that.
Now, every so often, you have some programs where we actually have smoke detectors that we give out. Do we have anything like that coming up anytime soon?
We do. They're available to apartment dwellers or residents any day, Monday through Friday.
Oh, so we have them now, so people can come pick them up?
Yes, you can come to the firehouse over here on Civic Square and pick it up. Fill out an application and you just walk away with it.
Is there any income guidelines or anything like that?
No, all you have to do is prove that you're a resident of Irvington.
Irvington, that's all. Okay, well that's great.
That's provided through the state.
Okay.
So most towns do have
some of those.
available.
Now let me ask you something. We went through, and you're part of our emergency management team, and we went through quite of an ordeal with Superstorm. I keep calling it a hurricane, but it's Superstorm Sandy. And I know you were part of our process. What did you think about that whole experience and how we fared here?
Well, that was a learning experience for us all. I don't think we've ever experienced a situation like that in town. We've had, days, a couple days or without power, but we never had weeks for the extent of damage that we had in town with the power lines coming down, trees coming down. All in all, I think our emergency management planning kind of helped us out and prepared us for that, to deal with it as best we could.
And we got something coming down the pike that's pretty soon over there at the over in the West Ward with
Wagner Place Firehouse.
Yeah, the Wagner Place Firehouse.
3, Old Firehouse 3. We're going to put an emergency operations center in there, and that's being funded through FEMA. And what that is, it's when there is a disaster, it can be anything from a major fire, a storm, anything that would require the different agencies in town, such as Public Works, Fire, Police, Health Department, to get together and coordinate a strategy to overtake an emergency or deal with an emergency. They all meet together. It's tied in with electronic communication devices, computers.
We even have a shelter in there, right? If
there will be a shelter there, a small shelter for transitional holding people. In the event that there's a major incident, we would have a fire apparatus station there.
And for non-emergency like we do now, we'll open it up for community meetings and stuff as well.
It's also designed as a community meeting place when it's not being used as an emergency operations center.
Good. Well, Chief, I want to thank you, and I'm sure Herb Glenn wants to thank you for coming by this afternoon, and looking forward, as always, to work with you.
I just want to, say one thing. You asked me about the fire prevention, that type of stuff. When you're cooking in the kitchen, make sure you stay with your food. Don't leave your house with the food on. Turn it off.
Absolutely.
Even if you're going out for a short while, just turn the stove off, or turn your range off. You're grilling, keep the grill away from the house, keep the kids away from the grill, be careful, watch what you're doing, keep your basements clean, keep your furnaces serviced.
Right.
All these different things, and be very careful when you're using gasoline. You can go on.
That was the issue during Superstorm Sandy. Everybody was doing these generators with the gasoline.
You have to be careful. You have to be careful. So, there's websites that you go to, ready.gov will tell you how to handle almost anything.
Yeah. And for the day, if you don't feel like cooking, you can come out here and get you some food.
All right,
thanks, Gav. Come on over, Craig. We'll get you in. Craig Lordigan is experienced licensed life and health professional. He's also an instructor who's taught at many insurance schools around the country. He has written various articles in the industry. He's a registered health underwriter and a chartered healthcare consultant, and consistently teaches. He has done advanced classroom training through the National Underwriter Company and Kaplan University. He runs the Lornigan Agency, and he's very active as a member of the Hope Chamber of Commerce. I know his mayor is a good friend of mine, Tim McDonough, and also the Mount Olive Chamber of Commerce. He graduated from Rutgers University with honors and is married for 29 years and has adult children, Nicole and Anthony. So thanks for coming up today, Craig. We want to talk a little bit about your industry and what you do to help consumers access healthcare. I'm going to start out. I know there was, because of my own working knowledge of the industry, there was some trepidation in the health insurance industry when this Affordable Care Act was being discussed.
Sure.
And has some of that been abated, or are brokers going to be allowed to sell health exchange to consumers and all those? What's happening in the industry as a result of this?
Well, ironically enough, I just came back from a conference with the National Association of Health Underwriters in the Atlantic region here, and we are very much involved in the process, as we always have been. We are at the table. Our job is to continue to get as many people enrolled as possible.
Mm-hmm.
So, in some cases you're doing work on a gratis basis. In most cases you're not.
Mm-hmm.
But we're definitely involved, especially with small businesses and medium-sized businesses that are confused, that don't have the answers as to what they need to know, and things like that. We're pretty much invaluable to the small business owner.
Okay. So one of the areas I want to have the viewers consider, because somebody made this example to me. They say in New Jersey you're required to insure your car, you insure your life, but the thing that makes sure you can pay for the car and make sure you're alive is your salary or your income. And a lot of people don't want to insure their income. Tell us a little bit about disability income insurance and why that's important.
Wow. That is a thorn in my side. Very much everybody that I come in contact with, when I do a portfolio review, disability insurance is at the forefront.
Mm-hmm.
And as many people might have lucrative jobs with high salaries and still have disability coverage at work, for those lucky people, they also have shortcomings that need to be addressed. But for the most part, most people that have jobs where there's no disability coverage don't have an idea of their most valuable asset, and that is waking up in the morning and being able to go to work.
Mm-hmm. So what do you suggest people, is there a certain formula for people who, as they try to address their need? Because if you don't have your income, you can't take care of none of this health care, anything else. So
that's right.
Is there a percentage of income people should be paying in premium dollars for this? Or
typically what we find is 2 to 3% of your income can more than adequately provide coverage for your income.
Okay.
And quite often I'll say to someone, if I offer you 2 jobs, one that gives you, $50,000 a year with no coverage, if you get sick, you're on your own, or disabled, And on the other hand, if I give you another option at $48,000, $49,000, but if you get disabled, I'll take care of you until you retire, which job do you want? Most people say the second, but they act on the first.
Okay. So now, many people also thought that because of the Affordable Care Act that their insurance, health insurance costs would go up. Are you experiencing any of that?
Unfortunately, quite recently, I've had some significant increases in group premiums. Most of my business is with small and medium-sized businesses from 2 to 500 employees, and as high as 90%. I had one recently in Pennsylvania where you would think that shouldn't be the case, and for the same carrier with a more expensive plan, a 1.5% increase. So there doesn't seem to be any rhyme or reason to it. It seems like they're preparing for...
So let me ask you something. So a lot of that, it may not be because of the Affordable Care Act. Is it because of the experience of that claimant? Like that institution, that company may have certain number of claims that require that their premium be adjusted upward because of the claim cost, and where a company has a better claim ratio, their premium may not see those spikes.
In New Jersey, we don't have that, so to speak, because the carriers are increasing premiums based on the entire zip code, county, or section of their book of business, whereas in Pennsylvania, it can be individually evaluated based on their claims experience.
So let's talk about the things that you wanted to talk about. I saw you have some kind of a presentation, so let's share with us some of the things you think important to our viewing audience would want to hear about as relative to the healthcare market, health insurance, and those kinds of things.
Well, obviously everybody needs, like prior presenters had mentioned, needs to take action and move forward and look into their options as an individual, and if you own a business, obviously your business. And like I said, most of my business is with business owners. What I can tell them is whether or not they have 50 or they're hovering around 50 employees, they need to address how they calculate 50 employees. It's just not a head count like we would think. It's a full-time equivalent head count. So, you count your full-time employees that work 30 hours a week or more every week, and that's a number. And then you take all of the part-timers that you might have, accumulate their hours, divide it by 120, because that's 30 hours a week for 4 weeks. And then you add that number to the 30 or whatever else you have, and that determines whether or not you have 50 or more. So it's not just cut and dry, I have 50, I have 49. It doesn't apply to me. So
that's why all this discussion about some people going to part-time employees so they don't meet the hours where they're considered 50 full-time employees or whatever. Yeah, I've been reading some of the stuff about how people are trying to maneuver to not pay these costs. So you've been in the business a long time. You've probably seen some major changes. Do wellness programs affect the cost of health insurance? Like we had Tell us how that impacts the cost of health.
More and more of the wellness programs are being presented to even smaller groups. And like I said, there was no incentive in the past for small groups to get involved and spend money on wellness because them as an individual were not being evaluated. So it was the entire state. Well, it's not me, it's the whole group. Nowadays, we find that it's important, even for small employers, to keep their employees healthy, not only for the insurance reasons, but to keep them at work more days a year. So health and wellness programs for the larger groups have been around for years, and they're just getting more prevalent. And what they're doing is they're saying if you do a health assessment with our third-party company that's going to come in and give everybody a health assessment, we're going to allow you to pay less in premium towards your contribution.
And and you work in the business market, so do small companies actually come to you to say, hey, how can we improve our insurance costs by getting some of this? Well, you either pay for it on the front end or pay more extensively on the back. Do they come to you for advice on who these wellness consultants are? Is that a part of your business that you do as well?
Yeah, absolutely, and that is also a gratis part of the business. So
Oh, wow.
people don't realize
How much you give
you
in your
get
money, yeah.
when you have an agent working for you. And although many people might not be actually specifically saying, I need a wellness program, they might be saying, how can I reduce my cost? That is what happens every day.
Right.
And the price of insurance hasn't gone down. It's gone up. So we have to be creative.
So in your role as a broker, you work for the client, not necessarily for the insurance company. You try to go out and find the best, most cost-effective deal for the consumer.
Absolutely,
Yeah.
or else I'd be out of business.
Yeah, okay. Well, Craig, thank you very much. We've enjoyed our discussion, and I'm sure Herb and We Care Partners will be drawing on your expertise in the near future. Thank you very much.
Sure. Thank you.
Hi, this is Mayor Smith again, and we're back to our healthcare forum. All of us and all the panelists, including myself, are consumers of healthcare services, health insurance. We go to medical institutions. But Fred Jones is with us in his segment to talk about the consumer view, just a direct consumer view of hospitals and healthcare. Fred, thank you for coming to share with us your thoughts.
Well, I've gone to St. Michael's here,
Okay.
Beth Israel, and even St. Barnabas and UMD.
Okay.
St. Michael's, I find it very hospitable. It's clean, and the doctors and nurses are there.
Somebody's trying to buy it right now.
Yeah, and that's what I was there yesterday for my knee, in fact.
Oh, okay.
And I've been going there for 11 years, just St. Michael's. And I was told that they're trying to sell it. Beth Israel doesn't want to be part of it anymore. But I found out that they just don't want to, they don't have the monies now, so I was told. It's there, but no one knows where it is. UMD, that's for everyone. Everyone. We know you can go in there. Beth Israel, the same, but as far as Beth Israel, my 3 times there, and not saying the whole staff, but it's necessary, but it's not clean. It's from the emergency room, it's good, but once you're on the floor, people forget their humble beginnings. Okay, and they're not attentive. St. Barnabas, there's a 5-star hotel. Okay, it really is. So if they can funnel some of that money back into our community, it would be wonderful. It would be gracious of them to do that. Because like I said, for 11 years I was going to St. Michael's, and this was because of my heart. And I try to get people to realize at a younger age, when you're not feeling well about something in your body, take care of it then. Because it's just like a Rolls Royce motor. Eventually it goes back. So I'm just glad that I'm able to go to the hospitals, and they're trying to cut these hospitals. So whatever we can do as a community, as people, not just in the community, but throughout the state, to hold on to some of these programs for these hospitals, would be beneficial for all, not just one set, but all.
Now, I would also suggest, as a follow-up, as a consumer advocate, if you will, to write John Brennan and Darryl Terry at Beth Israel and share what you experienced at Beth Israel. I'm sure they would want to hear from you.
Exactly.
Yeah, we really want to tell you how much we appreciate you and all of the effort that you're putting in to do outreach in our community. I asked Gene Pierce to stay with us because Gene has been a primary sponsor behind all of our efforts and initiatives in relationship to showing that our outreach effort is supporting what her organization is doing, the health professionals, allied employees, HPAE, and after working with her now, I kind of know it fluently, which is so important because a number of people don't know how valuable the Health Employees Allied Employee Organization really does effectively work in our communities.
with the people that work in our hospitals. And Jean, one of the things that's so important to me, I wanted you to know in terms of the sponsorship that we're getting, is that she wears a number of different hats. I wanted her to give you a few minutes of sharing with us exactly the other organizations that she's involved with.
Well, I could go on forever. So first of all, HPA is very involved with New Jersey Citizen Action. As the mayor mentioned, he sits on their board. Dina Matola was here, very good consumer group. We appreciate all the work that they do. We are also part of the Time to Care Coalition, which was a major player in getting paid family leave passed here in New Jersey. Now they're working on paid sick days for those who are part-time workers or workers without benefits. Mostly you see food service, right, just passed in New York. It was just dropped by Assemblywoman Lampett, I understand, I believe last week or the week before, trying to get paid sick days for those, again, service workers are the ones you think of most, who have to go to work whether they're sick or not just to get paid. And so we want to try to give them some help by having them get paid sick days. I'm also the state president for the Coalition of Labor Union Women. We are a not-for-profit, nonpartisan organization that tries to empower women in the workplace. We try to educate them as to the history of unions and what their role in a union should be and how they should be leaders in their workplace. We are also part of a new organization called Emerge New Jersey, which is focused on getting women to run, no offense, Mayor, more women to run for office here in New Jersey. It's a bit skewed. There aren't enough women in elected office. So we're also, especially in the legislature. Thank you. Yes, that's true.
Well, so, and I want to just say, Jean, we appreciate all your efforts. There has to be a collaboration between the community and labor organizations like yours. And so, and for lack of a better term, you represent, other than the physician and the nurses, you represent the back office, the people that keep the thing running,
yes.
So that doctors and nurses can function.
Yes.
IT, so, and then for the consumer, many times people come out of these institutions and need the social work. To navigate a whole host of things on their behalf. So the workers that you represent and the work that you are doing in the community reflect that kind of collaboration we need to have so that everybody gets served correctly.
I just want to again thank Herb Glenn for putting this. This is the second year I'm here. This is a great event. I encourage everyone to come out every year when we have the Irvington Health Fair, and We Care Partners has been extraordinary, doing extraordinary work. Thank you, Herb, for everything you do.
Thank you very much. Thank you, Mayor, and we'll be looking forward to the second half of today's afternoon series of activities representing the important values of health and wellness in our community and public safety. Thank you very much.